to let everyone know that I am recording as we speak. So if you're not happy for you to be a part of the recording, please will you leave the group now? Otherwise, the fact that you've joined the group indicates your consent to us recording. If you don't mind just making sure that you're on mute. And if you want to put yourself on video so that we can see you, we'd really appreciate that. So just so that everyone knows, the purpose of this Finding Health is because I firmly believe health is more than what you eat and drink, whether you exercise or that you avoid certain foods. I firmly believe that health is diverse, dynamic, and deliberate. I firmly believe that health is not possible under the hand of one practitioner only, or one discipline of medicine, or one discipline of healthcare. I firmly believe that health is a person's primary responsibility, and it must be person-specific. I firmly believe that health must be conversed on physical, chemical, emotional, mental, spiritual, cultural, racial, and various other undetermined levels. And I firmly believe that there must be a better way than what is our current status quo. So with all of that being said, I'd like to introduce you to Tejal Nagar. She is a wonderful physiotherapist. And I think where I want to start is, how can a physio and a chiropractor be friends? I think that's a good place to start. But let's make it less about chiropractors and physios, and let's make about, what you think about health is. So Tejal, I'm handing over to you. Let's hear your story.
Okay, so I think I'll start based on where this educational background is, where it came from, where it's going, so that we understand a broad perspective of who I am. So I qualified as a physiotherapist in 2007, so it's quite a while back from Wits. And I must say, I started off being a typical mechanical therapist. And I worked for many extravagant, beautiful practices. I can't say it was anything negative. I enjoyed myself thoroughly with lots of different physiotherapists, some older, some younger, and learning a lot more than I set out to at the beginning. But something was missing. Something was definitely not sitting well with me. I was not entirely happy with that setup. And it took a couple of years until about 2014, where I decided to venture out into alternate health. And I've always been interested in the psyche and human behavior. And I think that was that glitch in the system that I just couldn't get right, because people were ready to also be fixed, and I have a problem with that, because we're not fixable, we're changeable, we're adaptable. And as a result, with the motion into alternate health and the thoughts of it, and meeting different people with different mindsets, allowed me to meet the right people to guide me in the direction that I'm in now. A lot of what I do is based on...
I'm going to interrupt you. Tell me, so that people can understand, what is a mechanical approach to physiotherapy?
So it's exclusively the physical body, exclusively what is the system doing, what are the cells doing, what are the muscular systems doing, what's the joints doing, what are all just the physicalities doing related to other physicalities. So how is the shoulder moving in relation to the elbow, but not taking into consideration the internal and external factors that might not be physical?
Right. I think that's very interesting, because from a chiropractic standpoint, the mechanical side was very much pain orientated. So if the pain is in the shoulder, right, looking at the mechanics of the shoulder, it wasn't even looking at the biomechanical chain, which what you're mentioning is certainly where you started. And you mentioned the word alternative. I must be honest, I have an issue with the word alternative, but let me hear, why do you call it the alternative side of things?
In comparison to the scientific Western side. So in comparison to Western medicine, because that's where physiotherapy is sitting, right, on the very scientific, westernized model at the moment.
Right.
And as much as physio itself as a profession is trying to move and liberate from that thought, which is wonderful, and it's happening at a good pace, that's exactly, you know, where it sits. And therefore I always say alternatives, so that people understand and they don't get confused, because sometimes I can present and they kind of think this is all just part of physio, not realizing that I've enmeshed quite a few modalities from outside the physio world to create what I've created and what I present.
And I'm just picking up, you said that you feel that the physio profession is moving in that direction. I think that's very positive.
Much. I'm very excited because there's a lot more of pain respective physiotherapy that is happening, where we're not going, let's treat pain with pain. Let's treat pain with medicine. Let's treat pain with westernization. They are going more into the mindfulness approach than we are just sticking to how can we scientifically change you? How can we see you as a textbook model? And rather than that, seeing you as an individualistic model.
And do you feel, Tejal, that, as you mentioned, that you felt that something was missing? Do you feel that from a professional point of view that they feel that something's missing, or do you think that there's something else behind the shift within the profession?
I think there's something behind the shift in the profession. There's definitely
speculation. What is that?
So let's dive into that, because I mean, when we say there's these shifts, how far and how wide, and this is what I think I struggled with when preparing for today and thinking about today, was how far and wide is this going to go? A lot of mindfulness within the profession that we're getting from a lot of physiotherapists that are lecturing as well is a lot of mindfulness, a lot of coaching, a lot of understanding people and their pain, and keeping them into self-awareness and understanding where our control is of ourselves and how much dependency should we have amongst other professionals to fix us when we have the tools and the ability to self-heal.
I mean, I think this is the nature of this program that I'm wanting to have, which is Finding Health. And I think you've tapped into that so easily and so quickly, is how dependent should a patient be on the person that's treating them versus how dependent should a person be on themselves? But I mean, I feel that starts a really hectic conversation for everyone, is how can I start that process of being dependent on myself?
Yes. It's a difficult balance. And I think this is where that process, and people have got to understand that it's years of work where we have created a mindset, a model, where we've been also partly conditioned, whether it is a home situation, whether it is a teacher situation, a school situation, whether it's friendship circles, social circuits. We've got these thought processes. And then you want to come in and you want to start a healing journey of some sort. Now, starting at that point and telling someone you have control is vague, because they have so many other thoughts at so many other levels that we can't just give them something as simple as saying control, but it's a massive, massive entity to hold, and they know what to do with it all of a sudden. It's not a power. You know, that's the other thing. It's not a superpower any of us have. It's the fact that we've got to find that balance, because we all don't have the resources. We all have professions the way we do because we offer a resource of some sort that we all can contribute to each other's lives. And therefore, we need to understand where all our boundaries are. And all of us have different resources for ourselves as well as for others.
So, I mean, a person that's literally just looking for relief of their shoulder pain, why is this important for that person?
So if I could give, let's do it kind of an example model. If somebody comes in with shoulder pain and they come in and they say, shoulder pain is here, can't lift my arm up, fix it. Firstly, I've got to let them understand where this shoulder pain comes from. What have they done to contribute to the shoulder pain? Have they gone to gym and gone beyond their body's capacity? Have they sat in front of a computer and done complete completely something absurd. So teaching them a little bit of accountability as to where this comes from, and it's not as direct, obviously we're shortening this version, but giving them some accountability and saying, you do know you contributed to this to an extent. Obviously it's a motor vehicle accident, it's different, but then we're going to look at what compensatory behaviors and how we treated it and how we reacted to it and what are the traumas that comes into. But again, we're going to do an assessment where we're going, tell me about your shoulder, tell me about your patterns of pain. Are you aware if your pain is 24 hours a day, or is it just in the afternoon, or is it cumulative and it progresses through the day, or is it worse when you're going to bed and it's worse through the night? Does it wake you up at night? And keeping a person aware of the 24-hour cycle, because how often do they also come in and say, I have constant pain, but the pain's not constant. So raising that awareness and asking the questions so that they have to ask themselves and really think about the nitty-gritties of their pain behaviors. What can you do and what can't you do? And often they'll say, I just can't lift my shoulder. And then again, shifting it and going, how functional are you? Where's the functional impediment? Because at home, we don't sit here and play with our shoulder and go, I wonder if I can lift it today. It should be more functional. We should be more goal orientated instead of fixated on a certain small product of it. So again, raising awareness through the questioning process is highly important, but then going back and saying, okay, any past traumas, any past changes in life, how's the workplace been? Have you had a change in work? Has the position been a little bit threatened? And again, these are all done very, very nicely. Okay, so what's happening at home? COVID struck my family, lost father-in-law. How does it affect you? Husband's not doing well. What happened? I had to make sure I had to sleep in my son's room because he needed to recoup. So that changed my position. So again, now we're looking at emotional levels. And then that's how we combine it, because the questioning and that initial and the follow-ons are crucial to understanding the dynamics. And then allowing the patient to go, okay, I can see how automatically maybe the bed needs to be the first thing that changes. Perhaps I do need to take something as obvious as breaks from the computer. Perhaps I am emotionally strained. Maybe a day off wouldn't be such a bad idea. Maybe I need to send my 3-year-old son to granny's house so that I don't have to constantly lift him with the shoulder and create more trauma in it. And therefore lifting the burden and the excessive processing, because remember, it's never just one thing. We don't work that way. We don't compartmentalize as much as we think we do. We simply start off and we come in with one thing.
And perhaps to simplify it, what would you say is the benefit of this approach for the patient? Is that a short-term benefit? Is that a long-term benefit? Or is it a combination of both?
It's a combination of both, definitely. But I strive to teach them a long-term benefit more than short-term instant gratification, which is again a very westernized medicine model. It's going into the fact that if we make changes like this, not only once you get better, will you hopefully stay better? There are also other contributing factors to that, but also how can you be so aware that you can avoid this from recurring? So how often do we see patients that come in with the one injury and they come over and over and over again, and they go, yeah, now the shoulder's just permanently damaged. Till the day I die, it's going to give me problems. But why is that recurrence happening? Does it validate what's going on at an atomic level? Or are we recreating it? Because we have a lot of muscle memory, we have a lot of trauma memory that sits in the cells. So are we recreating it through similar patterns of lifestyle? How can we adapt ourselves to make certain shifts? And that's what you got to give them the goals towards, is that if we work on this kind of approach, maybe we can avoid, number one, the recurrence rate, and number two, if it does recur, reduce the intensity at each recurrence.
But I like the focus of the goal orientation, and certainly in my office we talk a lot about quality of life, and I feel, and perhaps you can direct us into that, is you're talking about muscle memory, you're talking about trauma memory, but surely there's got to be something far greater than that in terms of what this body of ours is good for.
Okay, so further unpack that for me a little bit more, but where we want this to go.
So let's come back to goals. When you're talking to someone about a goal, what would a goal be for that person? I mean, most people would say, my goal is to be out of pain.
Mhm, mhm.
So what's
I
a
think
further goal than that?
so. Further goal, and this is when we go, what are your functional limitations, right? Another goal is that. So we're going, we want to have reduced pain. Is reduced pain when you're driving as important as reduced driving when you're sleeping? Then from there, take it as that, is this reduced, is this pain reduction going to allow you to be consistently mobile in the form of exercise, which will allow you to keep some sort of sanity and mental health stability?
Yeah.
So that's, and then build on that. So to say, from physical, what are we getting out of it? Mentally, what are we getting out of it on a consistent level? Because quality of life is also about consistency. How can we maintain quality of life? Because if we have pain up and down on certain days, and that inhibits our function, inhibits our ability to go to the gym or exercise or run or do what we mindfully like, whether it's yoga, whether it's Pilates, whether it's anything, weightlifting, it doesn't matter. What is it stopping you from doing, and how consistent do you want to be with that kind of activity? What does that activity offer you? Is it offering you strength on a physical level? Yes. Is it offering you a distraction from life and keeping you in balance and in harmony and energizing you for the next day or the same day? And then pushing that through the system and saying, okay, that's a goal. When are we going to return to exercise? How soon can we return to exercise? And often I'll also say to patients, there are some people that don't care about the exercise part, but I'll go, let's introduce mobility. So even though it's not a goal, we start creeping in that goal so that the patient can see the benefit of it. And those that want to reduce their time off and want to return to activity as soon as possible, give them good, simple exercises that are more rehabilitative, that can say, look, you've still got a half an hour program. How amazing is that? You've still got a goal of getting through exercise daily, but we're doing it safely until we're ready to integrate you into what you wanted to reintegrate to.
But I like what you're saying, Tejal, about getting people to see it on progressively greater and greater levels. Because most people they don't necessarily see it that way. They just simply see getting out of pain. They don't actually see those linkages. And I think that's vitally important, is for people to realize how much they influenced by their body, positively or
Yes.
negatively.
100%. This is it, is that for me, the biggest thing that I talk about to my patients when we've done the interview process, or the subjective assessment as we call it, and we've asked the questions and we've got all the medication written down, and we've got all your pain properties written down, and we've got all the past history done, and then I sit down and literally put this stuff aside and I go, let's talk about what your body has been going through and consolidate all this information. Let's talk about when you fell off the tree when you were 12, and let's talk about the 3 ankle sprains when you were dancing at 18, and then let's talk about the motor vehicle accident when you started driving, and let's consolidate how then your back has now come to a point at the age of 30, and it's got this chronic pain feature to it, and then tell them it's changeable. Let's not fixate on it and think this is it. Because a lot of patients also come through and they'll say, I'm a back pain patient. They've classified themselves. They've permanently diagnosed that this will be it. And we've got to say to them, look, yes, this happened, and we've got the scar tissue in this ligament, and we've got a little bit of trauma in this area. What have we got that's working for you? What have we got? You've not hurt this muscle in this back. Let's create a system which can manage the stress you place on it. Whether it is a little bit compensatory initially, just to get the pain down, and then the harmony and the balance later once the pain has relieved. Because again, we never want to
word harmony a couple of times.
Yes.
Give me your ballpark definition of harmony.
Harmony. Good one. Very broad definition there for me. So harmony is how your body works on a collaborative level.
Okay.
Food.
Keep going.
This is where we go to all those parts. harmony is what you put in is what you get out, right? So the food that you put in, is it working with the pain? Because it's no use saying I'm in pain and you're having 3 chocolate bars, not drinking water, and you're binging on chips every day and creating a high acidity level in the body that's not helping or facilitating healing. So then you're not creating harmony. Also, not great in coming to one practitioner and saying, you're going to just fix me and that's going to be the end of it. And once you're done, you're going to go back to your lifestyle. This bridging gap. There's no harmony. So we've got to see all the contributing factors and how they can all be brought together so that there's balance between each one, therefore creating optimum health individually for that patient.
And just if we look at musculoskeletal pain, musculoskeletal pain at this moment in time is the largest cause of disability in this world today. Musculoskeletal pain will influence up to 80 or 90% of the world's population at any given moment in time. I mean, we're talking about a huge impact on life.
Yes.
So when you talk about harmony, I'm starting to get that picture of a different look at this world.
Yes, yes. And that is, again, I mean, obviously it goes into the drive of where you wanted to go. Where are we taking health care? How do we get people to view their bodies accordingly? I mean, it's got to do with also when there's dysfunction or when there's challenge to the body or when there's an irregularity to the body. Do we know which is the appropriate practitioner for that irregularity, for that dysfunction, for that challenge? Do we have a team that we can put together for our own lives that can take care of us holistically? Do we have the right people that sing to us, that talk to us, that harmonize with us again? Because again, not everybody will, we get this often, right? That will say homeopath versus doctor, right? And sometimes it's an educational decision and sometimes it's not. But again, if something sings to you more for a current condition, it's okay. Let's support it, but recognize, does it work for you? Does the doctor giving you 3 doses of antibiotics in a month work for you? It shouldn't. It shouldn't work for you. And therefore, if that's not working for you, do you go back and back and back and back until something's destroyed entirely? Or do we say, let's look at our other options? Let's see, because there are plenty of practitioners that are created, and we know this, and this is your goal in this kind of chat, is to find those different atypical practitioners that can assist us, that a lot of us don't know about, that can contribute, whether short-term or whether long-term, to some form of our health. And we must acknowledge that we change.
Just to give people an understanding that there are many different options, and those options 100%. Always start with them.
Yes, yes,
just
absolutely.
Just a question that someone has asked. I'm going to read the question as they've written it, and then I'm going to see if maybe I can try and understand it. So does this mean a person should exercise with a manageable amount of pain? So presumably we're asking the question of, can we exercise if we have pain? And what's your conversation with that? I think that for me is a very important question that people often ask.
Yes, yes. So again, it starts with self-awareness. It needs to start with, usually, is the pain as a result of exercise? Is the exercise an exercise pain? Is it pain of exertion? Is it the post-gym pain? Is it the pain where we feel we've just pushed our body a little bit, but there's no negative results and we can recover in 24 hours? Because we know we have that kind of pain, which kind of works itself through, right? Because we get a little bit of micro tears sometimes with a bit of increased weightlifting, which can sometimes be a bit healthy according to research. But we're getting also a lot of people that believe that pain is okay because at least I'm exercising. And that is not okay, because pain essentially is an alarm system in our body. And it's an alarm system for us to go, where is the dysfunction? If you're in a house and the alarm goes off, you immediately get up and you go, where is the disturbance? Why don't we do that when we have it happening in our bodies? When there's pain, we go, where's the disturbance? That's the first question. Am I creating the disturbance? Is there disturbance from somewhere I did not experience expect? Is this what is the characteristics of this disturbance? Can I describe this disturbance? And therefore manage it accordingly. Overall, I would say the safer answer is no, you shouldn't be exercising with pain. The only thing that should be allowed is a bit of exertion, discomfort, but there shouldn't really be pain when you're exercising.
I want to move the conversation more to the mental, emotional side, because I think that's something that people don't necessarily see with regards to pain. But perhaps as an introduction to that, what you're indicating is people should be having a definitive conversation with themselves on a regular basis.
Yes, absolutely. Absolutely. You need to understand what your pain definition is. And I also say to patients, don't forget, we have different tolerances in different parts of our bodies. I mean, it's that complicated. Some people can tell you a small headache sends them flying. They cannot function for 3 days. Yet you'll get someone that can function with a headache for 7 days. It doesn't make one better than the other. It makes a tolerance level that also complicates. But at the same time, we do need to see what are the external factors contributing to my pain and the behaviors of. Is it previous trauma? Is it just that I have created what's the word? A chronicity to it myself? Because that often happens, where we kind of like to buy into the fact that we're sick because that victimization serves us a little bit. Is it the fact that we
I don't know if you can hear me, Tejal. You kind of have disappeared. Tejal, are you there? Just unmute yourself, Tejal.
There we go. Sorry, I don't know why I disappeared. I just saw it shut down.
It's called technology, okay?
Technology, right? Not our thing. Okay. Yes, the external factors versus the internal factors. How much of pain is fear-based? Pain is a fear-based cycle. Once we experience pain, we have thoughts about pain that can recreate pain in different ways as well. And we've got to identify, that's why it's a complicated subject. Pain is very, very difficult, and especially because it has so many attributions, contributions, social. How many people also have a pain perception just because someone has given them an ideology of themselves, going, I have low back pain, I ended up in surgery, and then what does that create out of your minuscule back pain? You've now gone into this big exploding fear behavior. I can't be paralyzed. Whoever said you were going to be? You have one trigger point in the quadratus lumborum muscle and you think you're going to be paralyzed. But so, all of that comes in, right?
So how does the mental and emotional side fit in? Let's dig into that. We've got about 10 minutes left. So let's dig into the mental and emotional side in the next 10 minutes.
Sure. The mental and emotional side is the fact that we go into a state where we become negative. We go into a state where we kind of punish ourselves further sometimes because we feel, because we're in pain, either we cannot again functionally do something, or we can't do something on a more physical exercise type of level. And therefore we go, what did I do wrong? And a lot of people do that, where they go, I can't exercise, I'm going to put on weight. And they start creating anxiety beliefs, depression beliefs. They start telling themselves, well, what's the point? Let me just go back to bad eating habits because I can't exercise anyway. So none of this has a point to it. And then they don't get better. And then this pain becomes a bit persistent because unfortunately it doesn't zap on and zap off. We've got to have a little bit of a treatment technique, and that takes a little bit of time. And then that time that it takes gets people to also feel, why can't I heal quick enough? Why can't I get better quick enough? What's the quickest and the shortest cut to getting to the end of this? And then when that doesn't happen, because they believe, then is it the practitioner? Is it the fact that I'm not doing my exercises? Is it this? Give them and that's why, again, it's about giving them goals. If they understand some things, for example, you're going for surgery, 6 weeks, if that's what the operation requires you to lie in bed for 6 weeks, do it. It's the amount of time the body takes to heal. So it's very, very important for us to understand these goals, because these goals actually tell us that we have to be patient, and therefore that anxiety-driven mental behavior is not warranted, and we can calm down and change our behaviors as a result. If we continue that on a neurological level, we start creating more pain in different areas, and therefore that persistent and chronic pain creates a vicious cycle that needs to be broken with external sources sometimes. And that's where good teams matter, good practitioners matter, because we need to have positive talk to ourselves to feel better. Yes?
As a simple question, how many patients would you say are in the acute side of things? Very simple, very easy to clear out, versus how many people are either moving towards the chronic cycle, as you're mentioning, or are actively in that chronic cycle from your practice perspective?
I think I see a lot more people that are already in that chronic cycle, whether at the beginning of it or whether in the peak of it, but in that chronic cycle, majority of them, and we still see acute injuries, but a lot of people come in that chronic cycle. And it's again pinpointing the fact that we do not see the pain as the alarm bell that we need to investigate. We see it as, it's okay, it will pass, 2 Bernardos, 2 Nurophens, and let's see where we go.
Would you say that's regardless of people's ages, or would you say that there's certainly an age bracket to that?
I'd say regardless. I'm not really, I mean, definitely on a cultural level, we can say there are a lot of differences in age. But in the sense of mindfulness, I'm saying it's across the ages, if we kind of take away the brackets of religion and culture and race, because that does contribute, and that contributes in our socioeconomic contributions. But if you take that away, because again, it becomes complicated, I would say it's across the board. It's across the board. It's across all. And I mean,
the concept of mindfulness, as you've presented today, is so person specific. And what you're indicating is it facilitate that person specific conversation. And that happens from visit to visit in your office.
Every single time. And every time they come in, that needs to be revisited, because we have to keep a check on this. And as I said, it's more crucial through the journey, because remember, a lot of them come to you, no matter how much you say in that first session, thinking they're going to be fixed, that they're going to be 100. Some is in my control, but I'm more of a facilitator of healing.
Right.
I'm not the healer. I'm not the person that completely can revolutionize your body, and that's the kind of thing you got to uphold, is reminding them, because the drop can happen at any time. So if we stop having that conversation at any point in time, there could be a regression on the mental state, and therefore the healing process.
Sure. Tejal, I want to interrupt you, and then we're going to go into the big question. Someone asked, what is the impact of anti-inflammatories taken for pain in terms of the rest of the body and the impact on the rest of the body? I'm sure that this is a really detailed question. We've only got 4 minutes left, and we still need to get to our big question. So if you don't mind, just give me a quick indication. What's the role that you would say that anti-inflammatories or painkillers play, not in the acute care, but more in the chronic care?
Not much. I kind of advocate for your anti-inflammatories to come in the acute stage, 24 to 48 hours. Neural pain, very much specific, and that's when I bring in a doctor's guidance. I mean, if it's severe neural symptoms, then obviously we do need help on that kind of thing. And that is a very different patient-specific acute case, and that can be a long-standing story. But again, if you look at musculoskeletal, let's go very basic, musculoskeletal pain in the acute stage, that's when we want to get in just about 24 to 48 hours max of anti-inflammatories. After that, there shouldn't be any inflammation to treat anyway. Painkillers, We can do something again in that 24 to 48 hours. And then the management system. I often tell patients, this is how I want to use it as we go along.
And do you
If you
feel that
need help to sleep because the pain is
in the chronic cases, anti-inflammatories inhibits mindfulness, inhibits healing?
Yes. Yes.
Wow.
And that's it, is that we don't want it in the chronic stage, because it's that quick fix that we also find distracts the patient from doing the work and being aware of what their body is saying and doing. Because often I'll say to them, the best practice you're going to do when you go home is don't do what hurts. And people find that hard because they don't think about that so hard. But if you're going to mask it with painkillers and anti-inflammatories, how can you safely take care of your body during the day? Because you've masked the primary function of pain.
All right, Tejal, let's jump into the big
And that's
question.
to protect.
What would you like the future of healthcare to look like? And how do you feel that we move in that direction? 2 minutes to go. Here's the answer.
So again, emphasizing that we go on mindfulness-based behavioral change.
Mindfulness.
You need to have a consciousness
Yes.
based behavioral change. We need to have a consciousness to our bodies, to our minds, to ourselves, to our external factors, who we indulge our time in, who contributes, what do we value, how is our value system, how do we prioritize our life? How many people, again, prioritize work over themselves, over their health? I can't make the appointment, too busy at work. So how do we create a consciousness? How do we understand our priority pains? How do we understand our urgencies? There also needs to be that connection, right? That connection of understanding how the mind and the body network works, so that we can appreciate how, in the state where we cannot be a practitioner, how we state of health, how we can uplift ourselves, whether it is meditation, whether it is just great affirmation, whether it is just positive talk. And then I disappeared again. Hey, look at that for time. How awful is this? Quickly, we need commitment. We need commitment to ourselves and to our health. That is massive. Commitment, commitment, commitment. We need to commit. We need to make a contract with our health, with ourselves. Because if we do not stay committed to our health, it will fall off, and we won't get to holistically harmonize what we need to do to feel better and to actually get better.
I think next time, Tejal, we're going to have to dive into that, making a contract with oneself.